A very beautiful morning and another great day on the issues today to dissect critical matters about our community, state, and the country. Welcome to today's edition of the issues on IKD 106.1 FM, where we dive on health talks. Today, every Thursday, is all about health talks, talking about every talks that you need to know concerning health and everything you need to know on health. And today, we're having a special segment with the doctor. And today is all about pre-eclampsia. We're talking about pre-eclampsia today. With the doctor is already in the house to dissect this topic together. We all know that every Thursday from General Hospital Kurudu, we have a diverse talks on health when it comes to every issues in health. And today is another special edition where we have another air talks talking about pre-eclampsia, what you need to know about this pre-eclampsia, preventions, and also solutions. We'll take a quick breather. When we return, we'll dive straight to the meat of the matter today. Be right back. Back is to the issues on IKD 106.1 FM, and today we are having a special edition, as always, every Thursday, talking about health issues. And today we are having a special one from General Hospital Kurudu. And the topic for today is pre-eclampsia with the doctor is already in the house, Dr. Seriki. She's here right here in the studio with us. And of course, I'm Gift Obon. I'll be your anchor for today on the issues. And let's introduce our guest who's already here. Good morning, ma'am. Good to have you on the show today.
Good morning. Thank you for having me.
Yeah, it's a pleasure having you. So, talking about this topic, pre-eclampsia, is something that I know most people are not really familiar with, but I would want you to enlighten us more when it comes to this topic, to give the honor. What is pre-eclampsia?
Thank you for the opportunity. Pre-eclampsia is a complication of pregnancy. It's one of the several disease conditions that we call hypertensive disorders of pregnancy. So there is a spectrum. So preeclampsia is just one component of it. In fact, a complicated part of it. So amongst these classes of hypertensive disorders of pregnancy, we have what we call gestational hypertension, in which a woman who is pregnant after 20 weeks develops elevated blood pressure in pregnancy. Then we also have the chronic hypertension, in which a woman who has never been pregnant, who has never been hypertensive in the past, now becomes is the yes.
Okay.
That's chronic hypertension, in which a woman has been hypertensive in the past. That's before she actually gets pregnant, and then in the pregnancy, we see her with the pregnancy. So in chronic hypertension, there's um, pre pre-gestational hypertension, that is the hypertension predates the pregnancy. So in a situation where okay, there's hypertension and now it is getting complicated, which of course I'll explain later, then that's when we get pre-eclampsia, when we have elevated blood pressure with signs of end organ damage, which can be in different form, proteinuria, signs of end organ damage, or symptoms or investigation results showing that there's an end organ damage. Then we have the chronic hypertension, which can also now be superimposed with preeclampsia, and then we have the eclampsia itself. So preeclampsia is a complicated part of hypertensive disorders in pregnancy.
Okay, all right. From the look of things and from the conversation we are having today, it's obvious that when it comes to this pre-eclampsia, it is mostly affecting pregnant women. Let me say thousands of pregnant women out there. So, what is the symptoms?
Thank you for the question. Preeclampsia, I said, um, it's characterized by elevated blood pressure. Then we have proteinuria. However, it is a disease whereby you see the signs before the symptoms. So by the time a woman starts having symptoms, then preeclampsia is already complicated. And some of those symptoms include headache, blurring of vision, restlessness, inability to sleep, pain in the upper part of the abdomen, which we call epigastric pain or hypochondriac pain. And then we also have features of chronic kidney diseases, in which the patient is not able to produce enough urine. And then by the time we now do other investigations, we see other features that might support this end organ damage. So those are the common symptoms a patient might have. Commonly the headache, the blurring of vision, inability to see clearly, the epigastric pain or pain in the upper part of the abdomen, and not producing adequate urine.
Okay, so if a woman is actually having this experience, like you said, the blurry vision and then headache and the likes, and can she just conclude that probably it should be a case of eclampsia, or there are other procedures that a woman needs to go, maybe diagnose or something, for for her to be pronounced that she's having or experiencing signs of eclampsia?
When a woman has these symptoms, it is better for her to to seek professional help immediately.
Mm.
If a pregnant woman having these symptoms, she must see the doctor. So it is when we check the blood pressure, we notice that it's about 140, 90 millimeters of mercury, 160, 110 and above millimeters of mercury, and then we check the urine. She might already be passing protein in urine. Then with this in collaboration with the symptoms she has, we made the diagnosis of preeclampsia.
So, what is the risk factor when we talk about this pre-eclampsia?
Yes, thank you for the question. Yeah, there are risk factors because of the way the disease develops. So some factors have been associated to increase a woman's risk of developing preeclampsia. These include a woman who is getting pregnant for the first time, a woman that's getting pregnant at the extreme of ages, maybe around 18 years and above, 40 years and above, a woman who has stayed a long time before getting pregnant, we call it a long interpregnancy interval of about 10 years, or a woman who has other diseases inherent before she even got pregnant, like hypertension, diabetes, kidney disease, and so on and so forth. So those are some of the risk factors. Then a woman who also has family history, maybe she has a mother who had preeclampsia in pregnancy, or a sister, or their first degree relatives with preeclampsia. She is also at risk of developing preeclampsia.
Okay, when you talk about women that have stayed long, women who stayed longer before giving birth, like, can we give it an age bracket on this?
Yes, that's why the age of the woman, you mean? I said first pregnancy around 18 years,
Okay.
or 40 years and above. Yes.
So is it that is that like an early stage? It's a problem when a woman gives birth too early or gives birth too late.
Yeah, because there are some peculiarities associated with our body system at those extreme ages. For example, a woman who is about 18 years getting, most like that's her first pregnancy. This is related to the risk of a woman for the getting pregnant for the first time. Because in the etiology, there's what we call immunological theory. That is, okay, one of the factors that has been associated to increase a woman's risk of developing preeclampsia is her exposure to the paternal antigens. Because in the development of the baby, of the placenta, there's of course the maternal the maternal tissue and the fetal tissue come together, and then the paternal tissue come together. The paternal tissue is seen as a foreign body. So in the process of developing this preeclampsia, some physiological processes occur that trigger the process of preeclampsia. So that's why it is associated with extreme of ages and getting pregnant for the first time. However, for those that get pregnant late, what is usually associated is that most of them already have one comorbidity or the other, one disease or the other, most likely hypertension, diabetes. And as I said, they also increase a woman's risk of developing preeclampsia. So that is why it is more common among women at extreme of ages.
Okay, so when a woman actually is experiencing this preeclampsia, what are the complications or untreated when it's not treated? What are those complications of this severe preeclampsia when it is untreated?
The complications of preeclampsia, they are numerous because it is a multi-systemic disease. When I say multi-system, it affects all organ systems in the body, starting from the brain, all the organs you can think of. So in the brain, it can cause, of course, I said one of the symptoms is headache. And then when it becomes advanced, there's cerebral edema and the patient can have stroke, which we call cerebrovascular accident. It can cause heart failure. It can cause accumulation of fluid within the lungs, which we call pulmonary edema. It can cause liver rupture. It can cause abnormalities within the blood system, so that the patient's blood clotting mechanism will be affected or deranged. It can also cause the woman to even lose the baby. Before it gets to losing the baby, there's a restriction in the growth of the baby because enough blood is not being pumped to the baby through the because of the elevated blood pressure. So the baby's growth is affected. Then, of course, it might eventually lead to preterm delivery, and with all its complications, having to keep the baby in incubator, risk of neonatal death, and eventually it also cause what we call abruption placenta, in which there is premature separation of the placenta before delivery of the baby. Of course, leads to internal bleeding, and one of the major causes of death of women related to pregnancy. So those are some of the complications of preeclampsia.
Out of curiosity, let me ask this question: can a woman actually find out that she is having any sign of preeclampsia, or it's only when a woman is pregnant?
Yes, when you say preeclampsia, of course, it is pregnancy specific, and that's why it is very important. That's why we take it very importantly for in all women, anybody can have hypertension outside pregnancy, but in that case, there is no baby associated. But when it comes to pregnant women, it is more complicated because there is a baby involved, and the complications are usually more swift, so more severe. So it's when you say preeclampsia, it is pregnancy specific.
Okay, so you talked about safe delivery and all that. What are those measures put in place to ensure that a woman who's having preeclampsia delivers safely? So how is the rate or the risk factor? Could you say maybe from a scale of 1 to 10, there are women who survive this preeclampsia with the baby, delivering the baby safely?
Yeah, so many factors are involved in woman deliver, with preeclampsia having the opportunity of developing a baby safely.
Okay.
Depends on the severity of the preeclampsia, the time she presents, and the type of care she's able to receive wherever she presents to. So if the woman presents early, or if she has had very good antenatal care,
Okay.
and then there's early detection of the signs, okay, even before she starts developing symptoms. Okay, she goes to the antenatal clinic, the doctor checks, they discover, okay, she has elevated blood pressure, they check her urine, they discover she's already having protein in urine. Of course, no doctor would discharge such a patient to go home. Then the patient is delivered, and then the prognosis is really good at that time. And then, okay, if she presents, so what actually surrounds it is that the patient should have antenatal care, quality antenatal care in a good center, and then there should be prompt identification, diagnosis, and prompt intervention to safeguard further complications.
Okay. To talk to them, to enlighten them or educate them about this preeclampsia, what are those measures they need to take to reduce this risk of having preeclampsia?
Yes. So, in reducing preeclampsia, the program we are having now is one of the measures we can take, that is creating awareness. Yes, there is need for people to know that there is something called preeclampsia. It is killing women. As at last year, in the General Hospital Ikorodu, it's accounted for about 55% of our maternal mortality. So it's there, it's with us. And during our calls, there's hardly a day that we don't admit a patient with preeclampsia or its complications, which most of the time eclampsia, stroke, and all that. So it is there. So after knowing that there is awareness, then there is need for what we call preconception care.
Okay.
The care of a woman is not just when she gets pregnant. There is need for a woman, okay, who is planning to get pregnant, to see a doctor for her health status to be assessed, evaluated. If she has comorbidities like hypertension, diabetes, kidney disease, there is need for it to be controlled such that, okay, by the time she gets pregnant, okay, the risk of developing further complications will be reduced. And then when she eventually gets pregnant, there is need for her to attend quality antenatal care. It's not just antenatal care in the mission home or just anywhere. If you know you have a risk factor for it, even if you don't have a risk factor, make sure that wherever you are receiving your antenatal care is is a place where quality can be ensured. So whoever is attending to a pregnant woman should ensure that they check blood pressure at every visit, and then at the end of the day, when the symptoms or the signs is peak, there should be prompt intervention in order to safeguard complications.
Okay. Now we're talking about the delivery and all that, safe delivery and the likes. And we know that when it comes to pregnancy and women giving birth, there is something called postpartum symptoms where women experience this. So, what is this postpartum care when it comes to women who have experienced preeclampsia?
Yeah, thank you for that question. Yeah, postpartum care is very important in patients with preeclampsia or who have had preeclampsia because, yes, the treatment for preeclampsia is the delivery.
Okay.
You have to deliver the baby because it's a progressive disease. Once the placenta is there, the symptoms don't disappear except to deliver. And then after delivery, there is need for continuous monitoring of that patient, of the blood pressure, because there's what we call postpartum preeclampsia or postpartum eclampsia, which means a woman can still develop preeclampsia even after delivery. So we normally monitor, give them regular visits, monitor their antihypertensives, the control of their blood pressure, their kidney, their blood level, and all that till about 6 weeks.
Okay.
Most patients with preeclampsia, if it is just solely related to the pregnancy, everything normalizes usually within that 6 weeks. However, for those that have underlying medical conditions like
Okay.
chronic hypertension, diabetes, kidney disease, the blood pressure might not normalize. And for some of them, they might not even know even before the pregnancy. It is during that pregnancy we know. So it's once you are monitoring postpartum and the blood pressure is not normalizing, that means that woman has an underlying comorbidity. So in such a case, she needs now to, after the postpartum period, she needs to now continue receiving care with a physician. So that's the importance of postpartum care.
All right. With all this being said, even talking about taking care of women, postpartum care, are there also long risk consequences for women who would be having this pre-eclampsia experiences? And the reason is because of what you said, that a woman can actually even still develop this pre-eclampsia even after giving birth. So, what are these consequences? Are there long-term consequences?
That's why it is important for women, everybody to have a regular health check. The fact that you've delivered, yeah, past your postpartum period, you feel everything is fine, does not mean you should stop seeing your doctor. So you need to like continue seeing doctor, monitoring your health, and watch what you eat, exercise regularly. So those are some of the ways we can curtail the progression of preeclampsia to a chronic disease and eventually a long-term illness. So they all surrounds lifestyle modification for those that, for example, exercise. Those that are obese should reduce their weight. We should watch what we eat, and then we should make sure we have a good health seeking habit.
Okay, before we go further, let's open the phone lines. We might have one or two who needs to ask questions. This is still the issues on IKD 106.1 FM, and today we're talking about pre-eclampsia. The numbers to call in is 0904 1061 or 0904 We have Dr. Sariki in the house in case of any questions or anything you need clarification on. You can call in on the show. Good morning.
Yeah. My name is Ethan. I'm there from Alaska.
Okay, please go with your contributions or
I'm
your
a
questions.
center. Used to do every research. There's also the program I funded there during my lifetime. So from my own observation, I see complicated pregnancy in two ways. One, those who consume herbal medication.
0904 or 0904 We're talking about pre-eclampsia. All you need to know about pre-eclampsia, which is specific for women who are pregnant. If you have any questions, we have doctor in the house to take your questions. 0904 or 0904 And Dr. Sariki, from what Mr. Mustafa said, what's your take on that?
Oh well, I beg to disagree with him.
Okay.
Preeclampsia has a basis, and we understand the pathophysiology. Um, there's there is a there's an outlined protocol for the management of preeclampsia, and the patients get treated, they get better, and they are cured of their illness. So it has nothing to do with spiritual attack, because I think that's what he's trying to say. So it has nothing to do with that.
Okay. Out of curiosity, let me even ask this question. I know some women are fond of travel medical service or going to anything that has to do with travel just to get better. And some of them don't even believe in all these antibiotics that he even mentioned or anything that has to do doesn't have to do with travel med. But does this have any way to play out when it comes to this pre-eclampsia, maybe a woman developing it with all these straddle medical and also medicines that women do take when they're pregnant?
Unfortunately, it has led to the death of a lot of women.
Mm.
Preeclampsia or hypertensive disorders in pregnancy is a straightforward condition. They are straightforward conditions that when you come to the hospital, there are protocols for the management. It's simple. We know the drugs to give, what to do, and then the patient um, delivers a baby, recovers, and go home. But unfortunately, some who are hell bent on this tradomedical condition, medications and all that, they go to the wherever they go to, are given whatever they are given. But by the time they come, they're already having complications like eclampsia, convulsion, stroke. And at that stage, the mortality is high, very, very high. So it's not really encouraged. It's not encouraged, yes, because it has led to the death of a lot of women who would ordinarily have survived the condition.
So how can then women take care of their health when it comes to mostly those who are pregnant? Apart from the fact that we talked about antenatal, them going to antenatal, how can they be cautious to know that there are a lot of risk factors when one is pregnant?
Awareness, awareness. When you know, when you are armed with information, then they need to be empowered.
Okay.
Empowered as they should have that financial power to be able to take a decision, to be able to take care of themselves. They don't need to wait for their husband. Even men also need to know. They also need to be aware, so that um, the financial responsibility, they won't have to say, okay, until I'm available, that is when my wife has the permission to go to the hospital. She can't take the decision when it comes to her health.
Okay.
So there's need for awareness, there's need for empowerment, and then they should seek health care in the right places with qualified doctors.
Okay.
So, and then wherever they go, they should obey whatever the health caregiver instructs them to do. When they say take your medication, take your medications. When they say come for admission, come for admission. When they say your baby needs to be delivered for so reason, if you think, okay, you don't agree with that doctor's recommendation, you are free to have a second opinion from another qualified doctor. But when you're going to have that second, it shouldn't be too far. The interval shouldn't be too far, so that when complications have already set in, that's when you are now rushed to the hospital. And there is need for what we call complication readiness and emergency preparedness.
Okay.
Complication readiness is that, okay, you go to the you go to the antenatal clinic, the lectures are being delivered, you take note of all the complications that's been highlighted, be aware of them, and then have modalities to sort out those complications when they arise.
Okay.
There should be funds, there should be a means of transportation, there should be somebody like a support that will help you, maybe a neighbor, a church member, a sister, family member, that will help you get to the hospital when those complications come up. So those are some of the measures we need, in addition to whatever intervention the woman gets when she gets to the hospital.
Well, at what stage is this pre-eclampsia diagnosed? At what stage of pregnancy?
So I should have actually added that. It's usually after 20 weeks of pregnancy, which ordinarily we say 5 months from the layman's perspective. 20 weeks of pregnancy. However, in some women, before 20 weeks, we might actually notice this elevated blood pressure. In such a case, that means the woman has been hypertensive even before she gets pregnant.
Okay.
So the diagnosis of preeclampsia is usually after 20 weeks of pregnancy.
Mm.
Thank you.
Okay. Going forward, still talking about pre-eclampsia and women having awareness, knowing the fact that there are risks when it comes to this pre-eclampsia. You all mentioned when it comes to diets and food, lifestyle, and the likes, and we know some people even carry out when they're even pregnant. They still go on with their lifestyle dieting, trying to lose weight and all that. Does this has any effect on a woman who is experiencing pre-eclampsia?
During pregnancy, we don't advise women to lose weight.
Mm.
Rather, they should watch what they eat.
Okay.
So, because weight gain
Mm.
in pregnancy, there's a range that we look at. Okay,
Mm.
there's a minimum. Okay, you shouldn't, at least there's a rate at which you should go, because it's also a measure of how healthy the baby is, how healthy the baby is growing. So there shouldn't be excessive weight gain, especially if the woman is already obese. And at the same time, it shouldn't be too slow,
Okay.
so that okay, it gives an indication as if the baby is not growing well.
Mm.
So, however, to take drastic measure to lose weight while pregnant is not advised.
It's not advised.
Yes.
Okay, the phone lines are still open for you to call in if you have contributions or you want to ask questions. Dr. Sarah Kibelikese is still here with us right from General Hospital Corridor 090408211061 or 0904081161. The phone numbers to call today to find out everything you need to know about pre-eclampsia today. 090408211061 or 0904081161. Hello. Hello, you're on, please. Yes, good morning. Okay, where are you calling from, please? All right, go on. Hmm. Okay. Hmm. Hmm. Okay. Hmm. 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 Thank you so much, Neil, for your contribution. Thank you. All right, Dr. Sereke Belik, this is for you, and it says doesn't know what advice you have for women who prioritize more tradometh than orthodox.
Well, my advice to pregnant women, as I said, is please, your health is very, very important. It's not something you gamble with, especially when pregnant. It's not something you gamble with. Okay, you've registered in a hospital, then you go and register in a medical or wherever place again.
Mm-hmm.
What's the essence of the money you are spending? Because you spend money there, you spend the money in the hospital. What's the essence? So if and then okay, wherever you are going to register, just make sure that the information you are being given at the hospital when you come on the days you come for antenatal care, you are actually implementing it. You are educated so that
Okay,
at that
let's
place.
take this call before we go further with this. Hello. Okay. Mm. Okay. Mm. Mm. Thank you, Mr. Mustafa. Go on, please, doctor. Please.
So even if you go to a tradomedical, just make sure the tradomedical knows how to check blood pressure.
Okay.
Very, very important. And then the tradomedical should be honest enough to tell you that your blood pressure is very high. I cannot manage it. You need to now move on to the hospital. So that's very important. If you think because of money or whatever, I don't know your beliefs, you think you want to go to a tradomedical and you've registered at that's in an orthodox hospital initially, be armed with the information. Make sure that person checks your blood pressure anytime you go for the antenatal there.
Okay.
And then when it is high, move on straight to the hospital for proper care. Because a BP of 150, 140, 90 this minute, in the next few hours can become 160, 110 in the severe range. The next few hours, the patient can convulse. And once convulsion sets in, the complications are more. There is risk of she losing the baby, losing her life. So that's just my advice for them. Wherever you want to go to, make sure they have something, they have a facility to check your blood pressure.
Okay. All right. Our time is actually fast spent, but Dr. Seriki Belix, before I let you leave the studio today, let me get your parting words talking about legal practitioners out there, talking about midwifery, those who condone and encourage this kind of tradomed, and also to the government, how can they support and create more awareness on this?
The government is trying, especially because state government, is trying hard, trying its best to make sure that people who practice midwifery, either as medical mission holds or whatever, are integrated, are enlightened, are educated on the complications of pregnancy.
Okay.
So, but unfortunately, some of them they get this training, they get this knowledge, but they don't implement it for whatever reasons. Understand? So, the government is trying its best. Those that are being trained should implement what they are being taught. When you see a woman who you know is a high risk patient, she has eclampsia, she has elevated blood pressure, she has diabetes, her baby is big, this is her first time, she has had a surgery in the past, she has twin gestation. They are not cases you should manage as a midwife. So an enlightened, educated, and honest midwife will not keep those patients under her care. She will rather transfer them to the general hospital or wherever, a standard hospital where they will receive the proper care. That's my advice for them.
All right, thank you so much, Dr. Sariki Balikis. It's really been a great pleasure having a robust conversation with you with this topic, talking about preeclampsia. It's something that is actually a major concern for us, mostly women, those who are pregnant and even anticipating it, or also the expectant mothers. This is actually a big one because most people are not even enlightened when it comes to such situation. Most people don't even know there's something like this. So it's really a pleasure having you today to have this conversation with you. I know women out there have learned one or two, but what for those who have questions or would want to have more education on this, can they easily reach out to you in General Hospital?
Yes,
Ikorodu?
yes. General hospital operates 247.
Okay, so
So
when they
always
get there,
available.
what would they ask for? Who would they ask for?
When they get to General Hospital Ikorodu, they should go to the emergency. That's for pregnant women. They should go to the emergency section, the maternal and child care center (MCC).
Okay.
So when they get there, whatever question, whatever clarification they need regarding their pregnancy, regarding their health, they will be given there.
Okay, thank you so much, Doctor. You heard from her. Whatever clarification you need to go to the child and maternal
And child center.
center for you to get every clarification you need. And this is where we have to draw the curtains close for the issues today. Our time is fast spent, but stay tuned for other interest educator program coming up shortly. I'm Gift Ubona. Do have a blessed day.